Of the nearly 34 million people who identify as Black or African American, there are more than 1 million lesbian, gay, bisexual, transgender, queer people. African American people are and have always been a vibrant part of the LGBTQ and same-gender loving community. From trailblazing pioneers to modern-day heroes, LGBTQ African Americans have made enormous contributions to the ongoing fight for social, racial, and economic justice. When we talk about mental health, we must discuss it from a holistic perspective. Without mental health, we cannot be healthy. We all experience emotional ups and downs from time to time caused by events in our lives. Although anyone can develop a mental health problem, LGBTQ African Americans sometimes experience frequent forms of mental health conditions due to unmet needs and other barriers. Some situations are even more severe for LGBTQ African Americans who live at the intersection of racism, homophobia, and transphobia and face a number of critical issues, including economic insecurities, violence and harassment, HIV and health inequities, religious intolerance, and criminal injustice. There are different reasons preventing LGBTQ African Americans from seeking treatment and receiving quality care. Some reasons include a lack of information and a misunderstanding about mental health. Many people misunderstand what mental health is and don't talk about this topic. This may lead people to believe that a mental health condition is a personal weakness, which is often associated with shame and stigma. Because of this lack of information about mental health issues, it is not always clear where to find help or when you may need it. Fortunately, there are treatments and support for better mental health. Being culturally responsive is a mental health provider's ability to recognize and understand the role of culture, yours and the clinician's, plays in treatment and to adapt to this reality to meet your needs. While it's recommended to go directly to a mental health professional because this is their area of expertise, if you do not feel comfortable right away, a primary care doctor is a great place to start. The primary care doctor might be able to start the assessment to determine if you have a mental health condition or help refer you to a mental health professional. When meeting with your providers, ask questions to get a sense of their level of cultural sensitivity. Do not feel bad about asking questions. Providers expect and welcome questions since this helps them better understand you and what is important to you. Here are 3 tips you can do in order to seek culturally responsive providers. 1. Ask your providers questions about the kind of care they provide. 2. Seek care from someone who is affirming of your sexual, gender, and cultural identity. 3. Ask providers about their cultural backgrounds and how it influences your treatment. Your mental health providers will play an important role in your treatment, so make sure that you can work with this person and that you can communicate well together. And remember, seeking mental health treatment is not a weakness, but an act of strength.